Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. As needed, Albuterol Budesonide in mild asthma. Background. As needed use of Albuterol Budesonide has been shown to result in a significantly lower risk of severe asthma exacerbation than as needed use of Albuterol alone among patients with moderate to severe asthma. Data on Albuterol Budesonide in mild asthma are needed. Conclusions. As needed use of Albuterol Budesonide resulted in a lower risk of a severe asthma exacerbation than as needed use of Albuterol alone among participants with disease that was uncontrolled, despite treatment for mild asthma. The next article. Global effect of cardiovascular risk factors on lifetime estimates. Background. 5 risk factors account for approximately 50% of the global burden of cardiovascular disease. How the presence or absence of classic risk factors affects lifetime estimates of cardiovascular disease and death from any cause remains unclear. Conclusions. The absence of 5 classic risk factors at 50 years of age was associated with more than a decade greater life expectancy than the presence of all 5 risk factors in both sexes. Persons who modified hypertension and smoking in midlife had the most additional life years free of cardiovascular disease and death from any cause, respectively. The next article. Intravenous Tenecteplase before thrombectomy and stroke. Background. The safety and efficacy of treatment with intravenous Tenecteplase before endovascular thrombectomy in patients with acute ischemic stroke due to large vessel occlusion remain uncertain. Conclusions. Among patients with acute ischemic stroke due to large vessel occlusion who had presented within 4.5 hours after onset, the percentage of patients with functional independence at 90 days was higher with intravenous Tenecteplase plus endovascular thrombectomy than with endovascular thrombectomy alone. The next article. Overall survival with Inavolisib in pica mutated advanced breast cancer. Background. In the Phase 3, double-blind, randomized INAVO 120 trial, treatment with Inavolisib plus palbociclib fulvestrant led to a significant progression-free survival benefit, as compared with placebo plus palbociclib fulvestrant, among patients with pica-mutated, hormone receptor-positive, human epidermal growth factor receptor 2, HER2-negative locally advanced or metastatic breast cancer, who had had relapse during or within 12 months after completion of adjuvant endocrine therapy to conclusions. Treatment with Inavolisib plus palbociclib fulvestrant led to a significant overall survival benefit, as compared with placebo plus palbociclib fulvestrant. Hyperglycemia, stomatitis or mucosal inflammation, gastrointestinal toxic effects, and ocular toxic effects were reported more frequently with Inavolisib than with placebo. Next, we will be discussing articles from Journal of American Medical Association. Obesity variation among Asian, Native Hawaiian or Pacific Islander adults in the U.S. Obesity affects 2 in 5 U.S. adults and is a key contributor to cardiovascular kidney metabolic (CKM) syndrome. 1 Asian American and Native Hawaiian or other Pacific Islander adults are a rapidly growing demographic group. 2 But obesity trends are not well described, especially among younger adults where critical opportunities exist to prevent adverse CKM outcomes. This study examined temporal trends in high body mass index, BMI, calculated as weight in kilograms divided by height in meters squared, and obesity among disaggregated Asian American and Native Hawaiian or other Pacific Islander subgroups, compared with non-Hispanic white, hereafter referred to as white, adults aged 30 to 49 years in a large healthcare system. Next, we will be discussing articles from Annals of Internal Medicine. Development and validation of body mass index-specific waist circumference thresholds in postmenopausal women. Background. A 2020 consensus statement proposed body mass index, BMI-specific waist circumference, DOBC, thresholds to improve patient care objective. To determine whether stratifying BMI categories by BMI-specific DOBC thresholds improves mortality risk prediction. Conclusion. Further stratifying BMI categories by DOBC thresholds modestly improved mortality risk stratification, with larger DOBC predicting greater mortality, although the degree of improvement varied by cohort. Discrimination did not improve consistently. Next, we will be discussing articles from British Medical Journal. Global, regional, and national characteristics of the main causes of increased disease burden due to the COVID-19 pandemic. Objective: to quantify and identify the main causes of increased disease burden due to coronavirus disease 2019, COVID-19, pandemic. Conclusion. The COVID-19 pandemic significantly increased the burden of several non-COVID conditions, particularly mental health disorders, malaria in young children in the African region, and stroke and ischemic heart disease in older adults, with notable disparities across age and sex. These findings underscore the urgent need to strengthen health system resilience, enhance integrated surveillance, and adopt syndemic-informed strategies to support equitable preparedness for future public health emergencies. Next, we will be discussing articles from Lancet. Mitapivat in adults with non-transfusion-dependent α-thalassaemia or beta-thalassaemia, ENERGIZE, a Phase 3, international, randomized, double-blind, placebo-controlled trial. Background. Non-transfusion-dependent, NTD, thalassaemia is characterized by ineffective erythropoiesis and hemolytic anemia, leading to long-term complications, poor quality of life, and early mortality. No oral disease-modifying therapies are approved for beta-thalassaemia, and no agents are approved for alpha-thalassaemia. The objective of this study was to evaluate the efficacy and safety of Mitapivat, an oral activator of pyruvate kinase, in adults with NTD alpha-thalassaemia or NTD beta-thalassaemia. Interpretation. Mitapivat could be a new oral treatment for adults with NTD alpha-thalassaemia or NTD beta-thalassaemia by increasing hemoglobin concentration and improving fatigue. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Adjuvant chemoradiation and immunotherapy for extrahepatic cholangiocarcinoma and gallbladder cancer randomized clinical trial. Question: what are the clinical behaviors and molecular characteristics of extrahepatic cholangiocarcinoma, EHC, and gallbladder cancer, GBC, and what are effective and specific treatment strategies? Findings. In this randomized clinical trial, including 93 patients with EHC and GBC, chemoradiation plus immunotherapy was well tolerated, safe, and associated with improved overall survival and recurrence-free survival in patients with resectable EHC and GBC compared with observation, meaning this study provides robust evidence for a novel treatment strategy in a challenging clinical context for patients with EHC and GBC. Here are the articles from Journal of Clinical Oncology. Use of low-value cancer treatments in Medicare Advantage versus traditional Medicare. Purpose. Medicare Advantage, MA, provides beneficiaries an option to receive Medicare benefits from private plans. Although MA covers over half of the Medicare population, limited information exists about how utilization of cancer treatments in MA differs from traditional Medicare, TM. We compared use of low-value cancer treatments between MA and TM and analyzed variation in use of low-value cancer treatments across large MA insurers. To conclusion. MA has lower use of low-value cancer treatments than TM, with varying degrees across large MA insurers. Efforts are needed to identify effective strategies to reduce use of low-value cancer treatments. Here are the articles from Journal of Hepatology modeling the health and economic impact of pharmacologic therapies for MOSLID in the United States. Therapy that halts fibrosis will avert advanced liver disease and mortality. Therapy that halts fibrosis will reduce direct healthcare costs. Reversing steatosis alone is not enough to reduce MOSLD disease burden and costs. Increasing diagnosis of MOSLD is imperative to reduce disease and economic burden. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from gastroenterology. Diagnostic accuracy of timed barium esophagram for achalasia. Background and aims. Timed barium esophagram (TBE) is commonly used to evaluate esophageal motor disorders, though its accuracy is limited. The lack of standardized criteria for TBE interpretation, coupled with reliance on single measurements and outdated reference standards, limits its effectiveness. This study aimed to re-examine the accuracy of TBE interpretation using the Standards for Reporting of Diagnostic Accuracy Studies, STARD, approach and updated reference standards. TBE can accurately identify achalasia/FLA plus EGJ outflow obstruction when using multiple metrics in a classification tree model. This provides a simple, standardized approach to TBE interpretation that is superior to traditional single metric methods. Here are the articles from Clinical Gastroenterology. Lymphocytic esophagitis, a histologic pattern of various underlying disorders. Background. Lymphocytic esophagitis, LY, is a rare condition that has been reported in several case studies, but its diagnostic criteria and clinical significance are inconsistent. There are no established clinical associations, except for Crohn's disease in children. Our study aimed to determine if patients with LY have distinct demographic or clinical characteristics when compared with patients with increased intraepithelial lymphocytes, IEL, in their esophageal biopsy. Conclusion. Our findings suggest that lymphocytic esophagitis is not a well-defined clinicopathologic entity, but rather a rare and nonspecific histologic pattern associated with various esophageal disorders. Further studies should aim to differentiate between the underlying causes of this histologic pattern, rather than defining it as a single clinicopathologic entity. Here are the articles from Clinical Gastroenterology. Lymphocytic esophagitis, a histologic pattern of various underlying disorders. Background. Lymphocytic esophagitis, LY, is a rare condition that has been reported in several case studies, but its diagnostic criteria and clinical significance are inconsistent. There are no established clinical associations, except for Crohn's disease in children. Our study aimed to determine if patients with LY have distinct demographic or clinical characteristics when compared with patients with increased intraepithelial lymphocytes, IEL, in their esophageal biopsy. Conclusion. Our findings suggest that lymphocytic esophagitis is not a well-defined clinicopathologic entity, but rather a rare and nonspecific histologic pattern associated with various esophageal disorders. Further studies should aim to differentiate between the underlying causes of this histologic pattern, rather than defining it as a single clinicopathologic entity. Next, we will be discussing articles in the field of rheumatology. Association of soluble immune checkpoint molecules PD-1 and 4-1BB with CTLA-4 Ig treatment response in early rheumatoid arthritis. Objective: to investigate whether soluble immune checkpoint molecules in blood are associated with the treatment response to disease-modifying antirheumatic drugs in early rheumatoid arthritis, ERA. Conclusion. High plasma levels of SPD-1 and S41BB are associated with good response to CTLA-4 Ig with MTX therapy in patients with ERA. A combination of SPD-1 or 4-1BB levels and the proportions of PD-1 plus TFH cells in blood at baseline has potential for predicting remission after CTLA-4 Ig treatment. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Burden of cardiovascular outcomes after SARS-CoV-2 infection in South Korea and Japan, a binational population-based cohort study. Background. Despite the significant global impact of the COVID-19 pandemic, limited studies have investigated the long-term cardiovascular sequelae of SARS-CoV-2 infection, particularly among Asian populations. This large-scale, population-based binational cohort study with long-term follow-up aimed to investigate the association between SARS-CoV-2 infection and the risk of cardiovascular events. See conclusions. This binational study observed associations between SARS-CoV-2 infection and cardiovascular events during extended follow-up across viral eras. Complete vaccination was linked to lower cardiovascular events. However, the absolute risk of cardiovascular disease events after SARS-CoV-2 infection remained remarkably low, particularly for stroke and ischemic heart disease. Although these findings suggest ongoing vigilance and preventive measures remain crucial, they should be interpreted within the context of these low absolute risks when considering long-term cardiovascular complications. Here are the articles from Journals of the American College of Cardiology. Plaque vulnerability and cardiovascular risk factor burden in acute coronary syndrome, an optical coherence tomography analysis. Background: cardiovascular risk factors are strongly associated with adverse clinical outcomes, including acute coronary syndrome, ACS. Although individual risk factors have been related to specific plaque phenotypes, the relationship between the cumulative number of risk factors and plaque vulnerability has not been systematically explored. Conclusions: in patients with ACS, an increasing number of cardiovascular risk factors were strongly associated with greater plaque vulnerability, especially for culprit lesions. These findings may explain the relationship between traditional risk factors and adverse clinical outcomes. From JAMA Cardiology. Cumulative Life's Essential 8 Scores and Cardiovascular Disease Risk. Question: what is the association between cumulative cardiovascular health, CVH, through young adulthood and incident cardiovascular disease, CVD, in midlife? Findings: this cohort study found that higher cumulative Life's Essential 8, LE8, score from age 18 to 45 years, independent of LE8 score at age 45 years, and a positive slope of improving LE8 score from age 18 to 45 years, were significantly associated with lower hazards for incident CVD after age 45 years, meaning cumulative CVH as measured by LE8 may be a useful method for identifying the highest risk young adults and targeting them for primary and primordial prevention strategies. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Effects of a carbohydrate-restricted diet on beta cell response in adults with type 2 diabetes. Context: beta cell response to glucose is compromised in individuals with type 2 diabetes, T2D, possibly due in part to excessive carbohydrate consumption. Objective: this study was conducted to determine if a eucaloric carbohydrate-restricted (CR) diet, 9% energy from carbohydrate, 65% energy from fat, compared to a eucaloric higher carbohydrate (HC) diet, 55% energy from carbohydrate, 20% energy from fat, would improve beta cell response to glucose in participants with T2D. Conclusion: these results suggest that a eucaloric CR diet has beneficial effects on beta cell function in patients with mild T2D. Here are the articles from Diabetes Care. Economic costs attributed to diagnosed diabetes in each U.S. state and the District of Columbia, 2021. Objective: to update state-specific estimates of diabetes attributable costs in the U.S. and assess changes in spending from 2013 to 2021. See inclusions. State economic costs of diagnosed diabetes are substantial and increased over the last decade. These costs and their growth vary considerably across states. These findings may help state policymakers in developing evidence-based public health interventions in their respective states to prevent and control the prevalence of diabetes. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Neighborhood socioeconomic status and the functional outcome of patients treated with endovascular thrombectomy for ischemic stroke. Background and objectives. Socioeconomically deprived neighborhoods are known to have higher incidence rates of stroke and less access to high-quality stroke care. We aimed to examine whether there is an association between neighborhood socioeconomic status, NSEs, and functional outcome after endovascular thrombectomy, EVT, for ischemic stroke in a high-income country. Discussion. Living in a more socioeconomically affluent neighborhood was associated with a more favorable functional outcome at 90 days, but not with degree of neurologic deficit at 24 hours or radiologic outcomes. This suggests that NZS-based inequalities exist in the post-acute phase of stroke care, and highlights the importance of continuing to work toward health equity for patients with stroke. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Prolonged mechanical ventilation in critically ill patients. Background. There is limited knowledge about long-term mortality, care pathways, and health-related quality of life, HR-CAL, among patients in the ICU receiving prolonged mechanical ventilation, PMV. Research question. What are the long-term mortality, care pathways, and HR-CAL of patients receiving invasive PMV, stratified by weaning success? Interpretation. Our results show that 3/4 of patients receiving PMV who were discharged alive were weaned, but their HR-CAL was reduced. The decision to proceed with PMV should weigh in patient preferences for living with HR-CAL limitations and patients' likelihood of weaning. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Prevention of cardiovascular and other systemic adverse outcomes in patients with asthma treated with biologics. Rationale. Although clinical trials have documented the oral corticosteroid, OCS-sparing effect of biologics in patients with severe asthma, little is known about whether this translates to a reduction of new-onset OCS-related adverse outcomes. Objective. To compare the risk of developing new-onset OCS-related adverse outcomes between biologic initiators and non-initiators. Conclusions. Our findings highlight the role for biologics in preventing new-onset OCS-related adverse outcomes in patients with severe asthma. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. High heat exposure and medical utilization among the CKD population. Key points. Exposure to days with higher heat indices was associated with increases in weekly utilization for a population with CKD. Higher heat indices were associated with a larger increase in kidney-related visits than all-cause utilization. Higher heat indices were associated with larger effects on kidney-related emergency department use for those least likely to have air conditioning. Here are the articles from Kidney International Reports. Holistic Impact of CKD, a Clinical, Economic, and Environmental Analysis by Impact CKD. Abstract Introduction. Chronic kidney disease, CKD, is a growing global health problem driven by aging and the rise of comorbidities, including diabetes and hypertension. Although clinical and economic burdens have been reported, there is a lack of information on the multidimensional impact of CKD across countries with varying demographics and health system archetypes. Conclusion. This study demonstrates the multifaceted burden of CKD globally and supports the adoption of policies, such as CKD screening programs, and public health awareness to promote early diagnosis and treatment to mitigate the growing disease burden.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.